Our health is essential. It is linked to everything, for everyone, everywhere. Health isn't just about hospitals and medicines. It is about what we breathe and what we eat. The way we grow our food determines how we grow. How we get to work and what we do after work, it all adds up to a healthy or an unhealthy society. And we all have a role to play. Citizens, institutions, and stakeholders. By thinking health in every decision we make, we can have a real impact on people's everyday lives. The new Lisbon Treaty makes things easier. It's not just about politics. It also means simpler and more streamlined health management across the member states, helping us build a healthier Europe. From obesity to aging to patient mobility, every aspect of health is crying out for new solutions. And sometimes they're only a mouse click away. Know Your Air for Health, for example, is a website developed for allergy patients all over Europe.
Environment and health are strongly linked. It's really obvious if we think about it. For many people, especially for people with allergy and respiratory diseases, simply being aware of the risks can help to minimize the risk.
The website gives up-to-date air quality forecasts and pollen counts, region by region. It also gives practical advice for individuals who are sensitive to pollution.
Obviously, this is not a treatment as such, but by providing information, perhaps we can reduce illness.
And less illness also comes through healthy eating. And educating children about what to eat is half the battle. Kids learn by example. So providing nutritious, high-quality school meals is a priority. The EU School Food Scheme has a budget of 90 million euros per year to distribute fruit and vegetables in schools. The way we work the land also brings health issues to the dinner table. For example, consumers can be exposed to pesticides with small amounts found on harvested crops. These are called pesticide residues. They can be here, 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 or here. Since September 2008, there are new EU rules for pesticide residues.
The new European legislation promotes the sustainable use of pesticides and excludes from approval pesticides which are carcinogens, toxic for reproduction, mutagens or endocrine disruptors. This will be the strictest pesticide legislation in the world. If the risk is too high, the pesticide is not approved. Food safety has priority over plant protection. This is health in agriculture.
Health is on the roads too, or should be. Every year in Europe, around 127,000 people are killed and at least 2.4 million injured in road traffic accidents. They are also the cause of 34% of child injury deaths annually. Since 2006, EU rules have required the use of a seatbelt by all motor vehicle occupants.
If you look at the issue of injury prevention, it's an excellent example of the importance of health in all policies. Child passenger restraints. We want to get the child into the right seat for their age and size. That's going to be impossible without working with multiple sectors. We need to work with transportation, justice, the education system, in addition to all of public health, in order to solve this issue.
In Faro, Portugal, they've put road safety at the heart of the schools and community. The Safe Road to School program is a comprehensive attempt to educate and warn children, even to shock them about the dangers they face on the roads. Sessions with the police and rescue teams and visits to A&E units and rehabilitation centres for the injured all help to drive home the message. design of our towns and cities can also help improve safety. Smart urban planning can encourage people to walk to school or work and minimize the risk of road accidents. Over a third of our lives are spent at work, so safety issues are crucial here too. But each year, there are almost 6,000 fatal workplace accidents. Since 2002, their number has fallen by 17%. Working in partnership at EU and national level can help bring the figures down even further. Training impacts significantly on health. The European Social Fund provides 10 billion euros a year to help train and reskill 10 million Europeans. In Warsaw, for instance, bridging courses for nurses and midwives have helped 36,000 nurses bring their skills into line with the EU directive on mutual recognition of professional qualifications. In a word, that means better quality healthcare in Poland.
This is like bridging courses. Nurses have the opportunity to upgrade their skills, provide better quality services to the European citizens and health services overall.
Innovation has a role to play in health too. Spreading the best practices can mean that the latest information is available everywhere for all health stakeholders. Today, we are all living longer, but we need to spend more on health. That's why healthy aging is such a priority for the EU. Promoting health throughout life and tackling inequalities in care for the elderly must also be part of our efforts for a healthier Europe. This requires the strong involvement of all stakeholders. Through the new 10-year strategy for growth and jobs, Europe 2020, we can contribute to the development of activities that protect and improve the health of all European citizens.